friends, it's me, Christina. So this video isn't going to be on the topic of the virus that shall not be named, but there is something I really want to address in the case of Alexis Lorenze, which has been circulating social media, specifically on multiple anti-vax accounts. If you aren't familiar with the case, according to these anti-vax accounts, Alexis was coerced into getting 3 vaccines in order to get her blood treatment at University of California Irvine Medical Hospital in Orange County, California. Now, these anti-vax accounts are blaming the state that she is now in. You can see just severe head edema, profuse bruising all over. Often it's easy to jump to conclusions, especially when we don't have all of the information. The problem is when we jump to conclusions and share the information that isn't accurate, it can have profound downstream effects. Now, Alexis has shared her medical history, and there have been a couple threads online that have put together the information pretty well that I'd like to go over with you. According to these anti-vax accounts, they are blaming Alexis' condition on the vaccine, but we immediately run into some issues with that. We do know Alexis has a very rare condition called PNH, diagnosed January 24, for which she declined treatment, and this was in January. Now, PNH stands for paroxysmal nocturnal hemoglobinuria. Paroxysm means a fit attack or a sudden increase or recurrence of symptoms. PNH affects around 1 to 5 in a million people. It is severe and life-threatening. This disease is a clonal hematopoietic stem cell disease. I've discussed before how these hematopoietic stem cells are in our bone marrow and are the precursor cells to pretty much every other red blood cell or white blood cell in our bloodstream. So what happens with this disease is it means that the bone marrow stem cell starts making a lineage of cells with a specific genetic mutation. And in the case of PNH, there is a mutation in the PIGA gene. And the short version is that this leads to red cells breaking down unpredictably, leading to anemia and thrombosis in large vessels, such as the hepatic, the abdominal, cerebral, and subdermal veins. Once thrombosis starts, the only treatment is the anticoagulation and monoclonal antibody treatments, which target the complement system, part of our immune system. And the 3 medications are the eculizumab, the ravulizumab, and the crovalimab. The MOB is monoclonal antibodies. But the problem with these monoclonal antibodies is that they predispose a person to infections, particularly meningitis, by changing immune function. Hence the need to have all your vaccines up to date. We know that she presented to the hospital around the 9th of September feeling unwell with a headache. Now, Steve Kirsch likes to say that her treatment was refused prior to her receiving vaccinations. However, that is completely untrue, as you can see with her blood labs that she had actually had transfusions prior to her even receiving vaccines. And you can see here the daily rise in hemoglobin beginning September 10th. You see how the hemoglobin levels rise, as well as the hematocrit and the mean corpuscular volume. You can also see the ominous drop in platelets and the other deranged bloods labs beginning September 10th. So you can see that she was not doing well. Her MCH was high, her RDW was high, platelets were low and dropping profusely. Her white blood cell counts were low, and their MPV was high. Okay, now a high RDW, or red cell distribution width, indicates that there's something going on within the body that the body is trying to compensate for. It's necessitating it reproducing new red blood cells, and as it's in its race to reproduce these new cells, they are coming out non-uniform in size. They are varying tremendously from larger to smaller, so the distribution width is greater, and the body is trying to replace these because they are losing them somewhere. It's also clear that she had facial and head pain prior to the vaccine because her face and head were CT scanned, had a CT head scan on the 12th and on the 11th. They aren't just going to do a CT scan unless there's a reason for doing it, especially a facial one, so she was already having swelling. Additionally, on September 11th, they tested her for parvovirus, to which she came up positive. It is crucial to note that there have been studies that have shown that extensive purpura, or bruising, is presenting sign of parvovirus B19 infection in a patient with paroxysmal nocturnal hemoglobinuria. The patient in that study looked like this. Here is the appearance of patients with parvovirus and PNH. You can see the similarities. So Alexis had not been doing well at all. She was declining quickly and rapidly. They needed to start treatment quickly with monoclonal antibodies. Remember, those monoclonal antibodies will weaken the immunity, so you have to make sure the patient is updated on all their vaccines. It was then, on September 14th, several days after we've already seen CT scans performed, blood labs results, and had received platelets the day before. So again, she had received treatment. The next step in treatment required her to be up to date on all of her vaccines. And this may sound cold, but it's the truth. If she had been up to date with all of her vaccines, they may have been able to start treatment sooner, preventing how extensive her disease got. Now, many people are saying that it was those vaccines that caused this. It was not the vaccines. This was the next step of progression of her disease of PNH. Her presentation has been documented previously in another patient with PNH, which was exacerbated by parvovirus, which she also had. In order to treat this, she needed to receive vaccines, which she did, but not until days after being admitted to the hospital. Ultimately, Alexis is extremely unwell, and the only positive right now is that anti-vaxxers are at least giving her money. They're attempting to influence her treatment, whilst, of course, stoking anti-vaccine rhetoric. Their interference may mean that she unalives. She is vulnerable and being taken advantage of. So while I'm happy to see that she is getting some money for support, if ultimately they are going to change the way she is treated, they will do her harm. And in the meantime, they are causing profound amount of harm and damage in anti-vaccine communities by convincing people that it was the vaccines doing when it was not. So if you have seen this or you have shared it, please make sure that you have investigated a little bit more. I sincerely hope that it cleared things up. Oh, no. Stop. Anyway, I'll talk to you all later.